Bienvenidos, bienvenidos.
Welcome everyone. I don't think we're gonna be able to transmit through Facebook Live this time because the two people that were here, they are the ones that could do it. They're not here. But if it's recorded, it can be sent and then you can put it there and we'll send
Muchas
it.
gracias, doctor Rodríguez.
Thank you, Dr. Rodriguez, that this is what we're gonna do. We'll do it with time for next time. We just forgot last time. If not, then we would have done it.
Muchas gracias, doctor Rodríguez.
Thank you, Dr. Rodriguez. Thank you.
Bienvenidos a todos. Si nos pueden
Welcome,
indicar
everyone. If you can just put in there
de dónde se
where
conectan
you're
para poderlos
contacting us, where
localizar en
you're
el chat.
joining this afternoon,
Esta
there on the
tarde
chat.
tenemos una lista
Please, this afternoon we have a
con
list of
panelistas, así que estoy muy
very
emocionada de
great
poder
panelists. So I'm
escucharla.
very excited in regards to
Oh,
this
tenemos a
talk.
alguien desde India,
Oh, we have someone from India. That's
de
great.
Texas,
Texas,
Carolina del Norte,
North Carolina,
Las Vegas.
Las
Oh,
Vegas.
Allison, de East Coast Migrant Head Start
Allison,
Project.
it's
Bienvenida,
called my Head
Allison.
Start project. Welcome, Allison. Very good.
Tenemos de Snow Hill,
We have
Carolina del Norte.
someone from Snow Hill,
Bienvenidos.
North Carolina. Welcome.
Saludos, Sergio, desde Carolina del Norte también.
Sergio from North Carolina
Desde
and
Texas
Megan
nos...
from
Ah,
Texas. We
bienvenida
have
Rebeca,
Rebecca.
Luis,
Welcome, Rebecca. Luis
de Carolina del Sur también
from South
tenemos a...
Carolina also.
qué bueno. Ajá. New Hampshire, bienvenido. Y desde
From New
California,
Hampshire. Welcome, California.
Puerto Rico,
Puerto
Hospital
Rico.
Castañer, bienvenido.
Hospital
Solo para
Castañer.
darles un pequeño
Just to
recordatorio,
give
este
you a
seminario
little
está siendo
reminder,
grabado
this
y está
seminar is going to be
siendo
recorded
transmitido
and
en
it's also
inglés.
being transmitted in English.
Si nos siguen
If
en
you
la parte de abajo
are
de la
following
página
us
de Zoom,
from the,
van a
under
encontrar
this
interpretación, casi la
Zoom,
penúltima,
under the interpretation, under the
el
bottom, it's almost
penúltimo
the
símbolo, si dice
the
interpretación, van a hacer un clic
last
allí
symbol.
y
If you can click there, and then
el
you're
audio
gonna
allí
press
es de
the
segunda.
audio that you
El
wanna
primero
hear.
dice inglés,
The first one says
en blanco, el
English,
segundo que dice
and the
español en
second one
español.
it says Spanish for Spanish.
Entonces,
So
Alma,
then,
vamos a empezar.
Alma, can we start?
This meeting is being recorded.
Muy bien, entonces
Very
les quiero
good.
dar a todos
So
muchas
I
gracias de
wanna
antemano
first of all
y les
thank
quiero dar
you,
la bienvenida a este
and I
webinar
wanna
de
welcome you
Hace,
to this
Calor,
webinar
peligroso.
that
Cómo reconocer
it's
los signos y
very hot
síntomas
and it's
relacionados con las
dangerous.
enfermedades
How to
causas
recognize
por
the
el
signs
calor.
and symptoms related to the
Tenemos
disease
a
caused
dos
by
destacados
heat.
panelistas esta
And we
tarde, el
have
doctor José
two
Rodríguez
panelists,
Ramos,
Jose
del
Rodriguez
Hospital
Ramos, doctor
Castañer,
from
bienvenido doctor,
Castañer
y
Hospital,
tenemos
welcome
a
doctor.
señorita
And we
Alma
have Miss Alma Galvan
de la casa, ella, de Migrant
from the
Clinicians
house,
Network.
from her
Voy a
house, from
leer
Migrant
un
Clinician
poquito
Network.
de
I'm going to read a little bit
la
of
trayectoria de estos dos
the
excelentes
trajectory of these
profesionales que
two
de verdad yo
excellent
estoy
professionals,
muy
which
halagada de
I'm
trabajar
really,
con
really
ellos.
flattered to work hand
Entonces,
in hand with them.
comenzamos.
So then let's start.
El doctor José Rodríguez es el
Dr. Jose Rodriguez is a director
Castañeda en
and
Puerto Rico,
doctor
un
and
centro
director
de
of
salud
Hospital
calificado
Castañeda in Puerto
federalmente.
Rico,
Él ha
a
sido
federal
director desde el 2003
qualified
y ha
hospital. He's been
participado en
director
numerosos
since
proyectos
2003 and
clínicos
he's
y de
participated in
investigación
several clinical and
dirigidos
investigative projects,
especialmente a
directed
mejorar la calidad de
especially
la atención a los
to
pacientes en
to
su región.
make the
Ha
quality of the
promovido
patient, of the attentions
iniciativas
to
de
patients
vanguardia a
better in the
través de
region.
HERSA
He's
y las
promoted
colaboraciones
initiatives,
de
vanguard
disparidad
initiatives
en
through
salud.
HERSA
También ha
and
participado
disparity in health.
estrechamente con
He's
Migrant
also
Clinicians
worked
Networks
along with migrant
en
clinician
muchos
networks
proyectos de
in many, many
implementación
projects
y de
of
seguridad en
implementation and
pesticidas
safety in regards to
y todo lo que
pesticides
tiene que ver con
and
la salud
everything
de
that
los
has to do
trabajadores
with health
agrícolas de
of
Puerto
workers,
Rico.
of
Él
agricultural
también
workers
ha
in Puerto
integrado con
Rico.
mucho
He's
éxito el
also
programa de
integrated
medicina
with really a
ambiental
lot of success
ocupacional dentro de la Comisión de
occupational
Salud Primaria
medicine
del
inside of the
Hospital
primary
Castañer.
care
Bienvenido, doctor, y
health
muchas gracias por estar aquí
inside
con
of
nosotros
Hospital
esta tarde.
Castañer. Thank you, Doctor. Welcome. Thank you for being with
Gracias. Y
us this
como también les
afternoon.
comentaba,
Thank you.
tenemos
And
a la
like I'm also
señorita Alma
telling you,
Galván.
we have Miss Alma
La
Galvan.
señorita Alma
Miss
Galván es
Alma
la
Galvan,
principal
she
del
is
programa
the
Wellness aquí en Migrant Clinicians
director
Network desde
here
la
in
casa. La señorita
Migrant
Galván
Clinician
nos
Network.
ofrece
She's in her
psicología
house.
educativa,
She has
psicológica
education
y
psychology studies,
comunicación.
public health,
También cuenta
and
con una amplia y
communication in
amplia
health. She
experiencia en
also has a lot of
supervisión,
experience
asistencia
in training, technical assistance, and developmental program, everything that has to be that is related on border health, promoters, indigenous communities, and disadvantaged communities in areas like occupational and environment health, community mobilization,
psicoeducativo.
and
Bienvenido.
psycho educational work. Thank you, Alma. Thank you, Renee. Thank you. Thank you. So now let's go on with our dear Alma Galvan, and let's start this seminar. I'm gonna send this to you, Alma. Thank you. Thank you, Renee. And well, good afternoon, good night, or good morning, whoever is with us, and we're gonna continue with the next one. Jessica, if you do me the favor, where we are mentioning to you that this seminar is thanks to a subvention of the Security Administration and Occupational Health of the Work Department of the United States, and we're working with the creation of training for different organizations. This is part of this project. Next one, please. And today, what we're going to do is we're going to learn in regards to the signs and symptoms of diseases caused by the heat. Let's go to the next one. We are going to talk about the steps to prevent disease related to heat. Also, we're going to see a little bit of the resources and strategies to promote prevention of this disease. And we're gonna also talk about the rights and responsibility of the workers in relation to the diseases related to heat. And first, as you all know, Dr. Rodriguez is with us, and not only everything that Rene told you, but also he's a medical advisor in all the projects that we have there on the island. He's the one that give us the orientation and tell us how it needs to be done. So we're very happy to have this session because we're including everything, everyone in Puerto Rico. We have to talk that in the Caribbean, in the last years, they've been, going over the record heat temperatures. We all this enchantment island, but now the heat is extreme. The intense heat of this summers. This is a reminder that we're living in a world that we live in a world that the global temperatures are a lot higher, 1.5 grades degrees of before of the Industrial Revolution. All this information you can get in the 2018 survey. So then we are, let me see, we are talking about these temperatures continue to go up. They do continue to go up, and the extreme heat kills many more people than hurricanes, than tornadoes, and then inundation and everything. All and even all this together. So then we're talking about there's many things that are happening, and we need to listen to it because extreme heat is not always dangerous, but it's just always worry that we have and something we have to take in consideration and for what's happening right now and what's happening in for future generations. That's why this talk is so relevant, especially for the Caribbean and especially in the United States and in the areas where it's already really hot to start with. Thank you. If you give me a refresh of the presentation, I think there were some changes that are not reflected there. And this photograph is a photograph that one of our colleagues there in Puerto Rico and the Virgin Islands took because we have to realize that these are extreme events and these are the examples since something that can happen in Mexico, flood in hail that happened in Mexico, and something that happened in the beginning of June, an intense heat wave that happened in Puerto Rico. For example, in this agricultural market that you see is a farmer's market, that they did in the Virgin Islands, and they had to remove this because all of a sudden there was this tremendous rain that made everyone run, and it just broke, it just ruined everything. So this is affecting everything that we're doing. Next one, please. So then we have an alert, a specific alert for all the Caribbean in regards to this excessive heat, and this has an impact, a specific impact in the hurricane season for Puerto Rico and for all the Caribbean. This is the seventh consecutive year in which he already has a prediction of a hurricane and events like this, so terrible events, more than, so this, as you can see, everyone that works outside, whether it is construction or whatever it is, they are the ones that are involved or affected. They are the ones that are gonna have problems, the problems that we are supposed to prevent, so they don't have this disease relating to heat. Next one, please. So then, as you can see, this is not only in the Caribbean, but all over the United States where we can find this type of problem or this type of heat. Next one. And this is a very specific piece of information, something that we can see. Given the statistic of the Office of Labor Statistics, in the 57 deaths have occurred in workers from 55 to 64 years from 2011 to 2019. So this people are dying at this time on this year for diseases related to heat. Next one. So then, as you know, our webinars are always interactive. So you can write here on where it asks you to write who is it that are most vulnerable that you think. We're seeing the presentation. I'm updating it. Thank you.
Jornaleros en las esquinas. Muy bien.
Uh, people that work in the corners, the people that work that in a temporary
Trabajadores
manner,
del campo y de la construcción.
agricultural workers and
Los
construction
tutores.
workers. Thank you, promoters.
Niños.
Correct, because they're in the
Exacto.
field. Kids,
Las personas adultas, los adultos
adults,
mayores.
uh, adult people, older people, pregnant
Exacto.
women,
Dice los que cortan las yardas,
the ones that
los
fix
que
the
trabajan
yards,
afuera,
the
¿verdad?
ones that work outside,
Los agricultores, porque
agricultural
están
workers,
trabajando, si están
of course, because
recogiendo
they're
las
working,
verduras,
picking
los
up
vegetales, expuestos al
vegetables,
calor
uh,
extremo, ¿no?
fruit, they're exposed to this type
Personas
of
con enfermedades
heat,
crónicas,
extreme heat. People with chronic disease, diabetic, hypertension,
todos lo
kidney
mencionaban.
problems, diabetic
Roofers,
people,
sí, las personas que
roofers,
trabajan
yes,
con
the
los
people that
techos,
work
los techos de
on the
casa,
roofs,
porque
right,
trabajan con
Alma?
esa vea
Because they
de
work with
ese
this,
líquido caliente, que no
this
solamente
vea,
están
this
expuestos
hot
con ese
liquid. They're not
calentamiento
always
líquido que están
exposed
trabajando,
of this
pero sino también al
heat, but
ambiente.
also the
Doctor
liquid,
Rodríguez va a hablar
the
más
heat
sobre
of the
eso en un
liquid that they're
momentito.
working on. And yes, they're working on regards to, doctor is going to talk in regards to this later on. If we go to the next one, we can see that people that are isolated socially, they work outside, that they don't have communication network. If it's hot or they need water, it happens a lot with the adults. Every person that is in a disadvantage economically, they don't have ACs, they don't have fans, everything that needs to be there to fight with these heat waves. Also, people with chronic disease, also the communities of colors. If you see, we're talking about a lot of social determinants of this that make for people to be more in contact with the natural elements, and of course disease, and people that uh, either handle or expose themselves to chemicals like pesticides, and more than anything, immigrants, because like we've seen, in some of our meetings, they are working in these activities that are very, very difficult activities, whether it is outside, they're not paid well, and there's, just a lot of things. And this information, you can find it in climate investigation and on number 16, and we're going to give this information here. So we always think about the people that are outside, but also people that are working in enclosed areas like packaging workers, restaurant workers, and workers that are in areas that don't have the proper ventilation. They are really, really, they are really vulnerable to this type of diseases. And well, one of the things that you're gonna be able to see, next one please, so that we can find everything here, so that we can find all this slide, that agricultural worker are a special interest for us, especially also in Puerto Rico, because even though they're not considered agricultural workers, they have their ranch, they are agricultures, they do the work themselves, and they do the same function as an agricultural worker. This population specifically has 20 times more probability of dying of diseases related to heat in relation to other types of workers. This is data from the CDC. And well, let's give the doctor an opportunity to tell us and go deeper into this. I want you to tell us about what you think about when we talk about diseases caused by health, by heat. If you want to put this on the chat, what is it that you think about when you see about this?
Dolor de cabeza.
Headache, yes. Dehydration, heart problems, kidney problems, heat stress, uh, dehydration, exactly, all of this. And if you can tell me, then give me the next one. And before we go to Dr. Rodriguez, we always like to see this image. This is an image of a car, right? When we run it and run it and run it and we don't give it maintenance, it just says, this is enough, it stops. This is the same, right? This is exactly what it is. A way, a really easy way of explaining to the people what's happening when the heat stress, or when the heat stress happens, or when this happens. So, doctor, I'm gonna send this over to you now. If we can go to the next one, please. We're gonna see what is heat stress and the difference in regards to this. But we're gonna, before seeing what this happens, we're gonna tell you how what this happens in the body. And there's different symptoms for heat exhaustion and insulation and heat stress. I want you to see the body. The body has a temperature, a 98.6 to 100 of 37 grades, not Fahrenheit, but C. This is the heat they need, that you need, so that all your internal organs work properly. If it goes down or up in an extreme way, in the case of the heat, the body has to protect themselves, to protect the organs. And when they start to get altered, then these problems that we're gonna see, that's when they start. The first of all, our body has thermoregulation from like a factory setting, right? God prepared us like this and send us with all this in our system. It has heat receptors in our skin and also in several parts of our body. These are very important because this is what's going to send the information to our brain, and this is what controls temperature. The receptors send this up, and then um, it send this to for our body to defend itself and keep an adequate temperature, and this continues to work in the way that it's supposed to be. When our temperature is high outside of the normal, the metabolic system in our body starts to be affected. You start to sweat. Your heart is pumping blood outside more. The cardiac rhythm increases. So this makes a mechanism of heat elimination happen in the whole body. The system in your body activates to start to defend your skin and fight against the heat and avoid damage, and it causes problems inside our body. There's a lot of ways in which the body defends itself. First is evaporation, which is sweat. Then blood starts to run faster, and then there's also more amount of blood to the skin. So this is causes dilation, and you start to sweat a lot. Why? Because it's hot outside, so the body starts to defend itself to keep the temperature of the body. There's also direct contact with you want to drink hot, like cold liquids to digest it. The body controls the temperature. Also, the body asks you to seek shade, go to a colder place, and this is when this happens. The hypothalamus is already working because it needs for the body to regulate the temperature. When the heat is very high and the body cannot defend itself anymore because it's very tired of trying to defend it, so this is what brings this type of diseases related to or caused by heat. So this the body tries to eliminate the heat, and so less blood is reaching your brain. So you start to sweat, you start to get dizzy, you start to get a headache, uh, bloody blood on your kidneys. You urinate less the blood. You start to breathe deeply and faster because you're pushing out the heat from the body that has inside to defend itself, because the blood goes to the lungs, and the you can see when you're breathing, if you're breathing like that and you feel that it's hot. When this all this don't work, and the body goes into problems, and that's what we're going to see right now when you cannot defend yourself from this. First thing is exhaustion, heat exhaustion. We all go through this when we work outside on the road, on the ranch, and whenever the heat um, and and the temperature is gonna go up. It's gonna be more than 95 or 100 degrees, and you're gonna feel that, and you can get nausea. You can feel a little bit dizzy, a little bit weak, a little irritable, because your brain is getting less blood, and then the blood pressure can go up and down. You can sweat a lot. You can take your shirt off, and you can even, there's water dripping off it. Like they said, central temperature inside of your body, it could be normal if you measure it, but it can be a little bit high. Why? Because the body is works like this. Blood goes to the heart, and it's working more so that not to let us go to the other phase. We feel tired. We need to take this warning that the body is giving us to rest and protect ourselves to go into the next step or next phase. Next phase is sunstroke or insolation. This happens in Puerto Rico when people go to the beach just to get tan and just to get some sun. Here, the body temperature goes up, and you're making your body work faster to defend itself. If you see the skin when you're going through this, if you're on the beach, it's red. Your skin is red. This means that there's a lot of blood that is going through your skin and to eliminate the temperature that it's inside of the body. The body is already feeling that. The skin gets really, really hot, and you're gonna get a headache, and you can start to get nausea, and then you're gonna see the you're feeling that you're getting cramps, muscle cramps, and breathing faster. There's a lot of people that gets deoriented, and if you take your body temperature, it's gonna be weird if it's normal. You're gonna see that it's gonna start to go up, and you're gonna see that it's working, uh, actually working. The body is working harder to defend itself, and so that you can continue to remain control. The body keeps working, and that you can continue to see correctly the temperature and the mental state. This is what makes the difference in regards to sunstroke or insolation, in regards to heat stress. And then this is asking your help. Uh, this is asking, your body keeps asking you to go deeper, go to the shade, drink water, and get away from the sun. And if you don't hear, if you don't listen to this warning, and which is gonna be the heat stroke or the heat stroke, the temperature, it's already mm, having a really hard time to control the temperature that it's affecting it. So there's a lot less blood flowing on the to the brain. So your mental state, it's going to be affected. If you take your temperature, it's going to be high. If you breathe, and if you put your hand on your inside, in front of your mouth and nose, because of to measure your breath, you're going to see that it is hot. You're going to have neurological problems. You're going to have a problem with your equilibrium. There's confusion, because you're getting a lot less blood and electrolytes to several parts of the body. So the brain is going to start to defend itself. So when you get a convulsion or a seizure, the muscle starts to move, right? And what does that do? It's releasing heat to be able to defend itself. But if you stay like this for a long time, then the brain can be affected. It's going to start seizuring, and you're not going to be able to fix it. It's going to affect that you're affecting the circulation that goes to the body. There's confusion, delirium, coma, when the doctor stupor, when the patient is really bad, in really bad shape. And next phase from this is death. Why? Because the body already tried to defend itself, send you all the warnings that it could. You didn't listen to it. So there's nothing else. The body can't do anything else. There's there's a heat stroke. You go to the, you're far from the hospital, far from the shade. Next one, next race that is gonna come, it's death. There's no blood in the brain. The heart is working so much, it's already tired. It's gonna affect the kidneys. It's gonna the muscles are trembling, are shaking so much to get the heat out. This is gonna release proteins, creatinine, and this goes to the kidneys, and everything that works, that comes from this, it's a crisis that is going to lead you to death. Next one. It is very important for us to listen to our body. Our body, it's giving us warnings, and we need to listen to it. Now I want to talk to you a little bit in regards to interaction with heat and pesticide, because there's many places in the United States and in Puerto Rico they use pesticides. I learned from agricultural workers when I go to conferences that they get up really early in the morning to spray the pesticides. And I was saying, why? And they say, why? Because really early the temperature is lower. The pores of the skin are closed. When the heat starts to come, the pores on your skin, they open up to start to sweat, so the blood flows. So that if we apply the pesticides at that time, they can go into our body easier, and they can affect us more. That's why we need to be very careful. That's when we see a circle of the how the efficacy of the pesticide and how it works. The effect diminishes, and then especially phosphorates. What does it do if the way that they work starts to go down because it's not applied correctly and it doesn't make its effect that it diminish? You need to do more. You need to use more. The concentration of the pesticide in the air increases. Why? Because the volatilization range, it increase, it's more volatile, it goes to the air, we become more vulnerable. So the disease increases. Why? Because there's going to be more complications on the way because the pesticides start to go into our body. So we need to use more protection equipment. Why? To protect, because the pesticides is more into the air. It's gonna affect us more. Our pores are open. We're gonna get more pollution. The pesticide can fly and go to certain areas and affect us where there's no equipment of protection to avoid pollution. The pollution, the body temperature increases. The body has to protect itself. So this is what makes the danger increase on this on populations that are close by. Mm, it's also, it's not only the people, the person that works with pesticide, but whoever is close. This can even affect our communities, and they can need more pesticides to control this. And if we protect ourselves more, we alert the community and we tell them that the pesticides and the heat interaction is a very complicated thing. We have to be very careful. This is in Puerto Rico, which initially when we start working, people used to prepare the pesticide and then they would say, let's say, let's put it some drops, a can of a can of meat to this. And then what does it is that the toxicity increases, and then the hot increases, the heat increases, and then that's where the complication comes in at. There's other factors that affect this. The heat that you feel, it's another thing that it's affecting it. We're going to see about this next. The environment, temperature, if it goes up, it's going to affect us. Humidity, the humidity, that's why you feel it more. That's why this heat index that you have on your cell phone, how is the temperature? 95, and it tells you it feels 98. This is what you need to listen to, not the one that is the actual measure. Shade, we've been cutting down trees in every place, and we just don't have any shade anymore. The wind also affects the heat. You need the wind to blow so that it takes away the hot. But if you're in an area that was hot, there's humidity, there's no shade, high temperatures, there's no wind, we're in risk of having heat stroke. We have to listen to our body and our body's indications. We have to be hydrated, well hydrated. We know that we work during the week, and when you get home at night, if you don't hydrate, if you don't eat during the night and the morning, you're already gonna have trouble of being dehydrated from your body. You're gonna be going to work and you're gonna expose to yourself to your heat again, and the dehydration goes up again. It starts to increase. This is a lack of liquid in the body. 60% of the blood is water, so we need to be really hydrated. If we start our work when we're already a little dehydration at 5 p.m. after 8 hours of not eating well, not hydrating, not protecting yourself, you're at risk of heat stroke, and then you could die after that.
Si regresamos un poquito a
Doctor,
esa
if we go back to this one, we just need to mention that this is a study
¿cómo se llama
that,
esta organización? La
what's the name of this organization? The
hizo este estudio
Field Workers Organization of Florida. They did this, of Florida, they did this a study on workers on the field. This is the people that were already dehydrated even before starting working. And this is what I want you to remember. You have to start hydrating since the morning and at night, because the heat stroke not only happens on people that are exposed outside, on outside, outdoors, but also indoors. And I have a question. All this process that you're mentioning, how long does it take for for you to get a heat stroke? This depends on the condition of the patient. There's risk factors that increase that it happens quicker. If you don't have any disease, if you're young, it can take a while, but uh, if depending on the hydration level and the heat level, but time is significant from going to installation of sunstroke to a heat stroke, because you're not defending your body. Your body's not defending itself. The body's gonna get tired an hour, the body's gonna get tired, the heart is gonna be tired. The heart pumps 5 liters per minute, so 60 minutes pumping at this rate is normal. But when there's heat, instead of 5 liters, it's gonna pump 10 liters. So there's gonna come a time where the heart is gonna be tired, all the body's gonna be tired. And there's also risk factors, which is the use of alcoholic beverages. If you are gonna go to work and if you drank coffee, or yes, this is gonna affect it. If you're using blood pressure medication, this is also affected by it, because they are medications that are diuretic, and they help you pee to lower the blood pressure. If you're using medication for flus and allergies, this is gonna take dilation of your of it, and then it's gonna uh, make you get less blood to your skin, and this is gonna affect it. If you have hypothyroidism, or if you got low thyroid, this is gonna if the or hyperthyroidism, high thyroid, it's working already on a very high rate. And there's other condition, if if you're diabetics, hypertense, if you're pregnant, if you have diseases in your skin, and everything is gonna affect it. And if everything is gonna affect the rate in which the body works. If you're obese, if you're a kid, if you're older than 60, if you don't hydrate, if you don't eat, and if you work with a lot of clothes on to protect yourself from the sun, if it's not adequate, this is gonna accumulate the heat, and this doesn't let sweat do the conversion that needs to do. This is doesn't let your skin be refreshed by contact to protect the heart. And everything that the doctor is saying, these are the factors related to the people. If you go back one, and these are the ones that are the factors related to the environment, outside environment, temperature, humidity, shade, and a wind. And they're telling us there's an app in which you can see, the doctor was saying, how things are outside. And so it has to do with you and with what is outside.
Y también hay una pregunta
And
aquí
there's
en el chat
also
que es muy
a
interesante.
question, very interesting question on the
Bastante
chat, and
interesante.
we're going to be covering later
Dice que
on.
algunos
It
trabajadores
says
evitan
some working
mantenerse
avoid
hidratados
to
porque
be hydrated
no les permiten de repente esos breaks that
because they're not allowed those
pero más
breaks to
adelante
go to the
vamos a cubrir
restroom.
un
But we're
poquito
going to
de
cover that a little bit
la ley
more
OSHA,
in regards to what
ajá,
the
para
OSHA
proteger a
law
estos trabajadores.
does to protect those workers. You're completely right. We're going to talk about that later on. Yes. This is very important. Hydration is very important. It needs to be protected. You need to go to the restroom, because if not, then there's going to be more complication. Let's go with the prevention. We're going to you, Alma. So let's continue with this. And this is very, very simple. This is one of the things that can be prevented the most. Heat stroke can be prevented. but we need to know what's the stage that it's on, and we need to do three simple things. There's no more than this. First is water. Hydrate yourself, drink water more than as much as possible. Rest. There's no way around. Go to the shade. And the next one, shade. These three things are the ones that are going to protect us from having a disease related to heat. And then the doctor was talking about protection. What type of clothing we're going to be using? You can put it on the chat while we go to the next one. What type of thing? Because some people say if I'm more covered, it's better. And they say, some people say, I need to, get the stomach flatter and I get more layers, right? We have to be careful for that. Cotton shirts with long sleeves, pants, cotton pants, and a hat, a big hat with a big border can protect you. And as you can see, many all the people that work in the fields, they cover their heads, wear a cap with a bandana, and they cover themselves and to hydrate and they to keep hydrated. They some of them put a towel, a wet towel on to keep this cool. You can see the image here. You don't the adequate protection. You need to use this. No shorts, no short sleeves, especially if you're working in the fields, not just because of the interactions of pesticides, but other chemicals, right? This interaction is really terrible and it can affect you in a really bad manner. You need to, this is what the doctor was telling us. We need to avoid energetic drinks, everything that has a lot of sugar, everything that has diuretics. Why? Because what it does is it makes you go to the restroom more. So that's the reason, right? People don't want to drink water to avoid drinking water. That's why the law has to give them time for the people to keep hydrated and for the people to go to the restroom, right? So I've seen, and we all do this. It's really hot. I feel like drinking a beer. Of course, everybody feels like drinking a beer. Everybody, wants to do that, but when you're working, it's just not possible. What this causes, Alma, is that when you drink an energetic drink or drink with sugar, the body is going to defend itself to eliminate this. And to eliminate sugar, it takes the water away. So the water goes away and it makes you dehydrated. And also the coffee, right? Also the coffee because of the caffeine, yes. And as you can remember that always in the morning you try to drink your coffee, all the routine, it's not, sometimes it's not made for this type of days. That's why it's also important to drink a lot of water, especially kids and elderly people. And also the beer makes you pee more often. It takes away the water. And we're gonna talk about this case, and this is because of the yeast that the beer makes you pee. And we're gonna talk about this case in Florida in regards to the citrus in Florida. This is Fermin Velasquez Ramos. He's 37. He was 37 years old, and he died picking up oranges in Immokalee after having symptoms of heat exhaustion. He was new, and the only thing that he drank in the morning was Coke. And he started after working after the day after the midnight. He was feeling agitated, deoriented. He was feeling dizzy, and after 45 minutes after he left his street to go get water, he passed out, and the leader of the place actually didn't see him. He just landed on the in where there was no shade. he walked past the place where he could get water. It was really bad heat, and the cause of death was heat stroke. The thing is, or the important fact here, it's because he was new at work. Why do you think he died so quickly if it was the first week of work? Why do you think this happened? Put it on the chat there. Thank you, Dalia. Okay, so while you do this, well, let's go to the next slide.
Alma,
We have one response.
falta de entrenamiento,
Lack of
falta de
training,
educación por
lack of
deshidratación,
education, dehydration.
no training,
It says here no training.
el golpe de
He has
calor,
no education in regards to heat
no
stroke.
había recibido
He
entrenamiento,
hadn't received any
su cuerpo no
training.
estaba acostumbrado al tipo de
His
trabajo,
body was not used to this type of work.
lo que consumió no le ayudó,
What he
no
consumed, it
estaba
didn't work.
aclimatado al
It
calor,
didn't help him.
no comió y se
He
deshidrataba.
wasn't
Todas
acclimated
muy
to
buenas
work.
respuestas. Ah, mire, aquí hay otra que dice, una respuesta que dice,
And
tomó
there's another response that
desalimentó
says
correctamente.
he drank soda and he didn't eat correctly.
Muy buenas respuestas, Alma.
Sí, muchas
Very
gracias.
good responses, Alma. All of you are right. All of those factors are what made this happen to him. So what I need to talk about this is acclimating. All these factors that he said, acclimating is very, very important. Acclimating to work, acclimating to effort, acclimating to heat, acclimating to space. When you go into a type of work, even if it's an office, you have to get used to it. This is what acclimating means. How long does it take for a worker to acclimate? How long does it, more or less, does it take? 1 day, 2 day, 3 days,
Una semana, dicen por ahí.
1 week, they say. They say a week, depend every 3 days. You're right, 2 weeks. You're very right. Let's go to the next one. We have to acclimate. Around 4 and 7 days, 1 week. This is what we need to acclimate. Not only to temperature, which is very, very important because we think I just need to acclimate to temperature and I work 8 to 8 hours because I want to make the standard of what I want to make or pick or I need to pick more oranges. You know that there you're paid for the bottle in regards to the amount of containers of oranges. So that makes a lot of worker to strive more to work more. So you have to acclimate not only to temperature for the but for the task. And this it's acclimating. NIOSH, an organization that is for workers, given the local condition that you have, right? You have to first see what are the local conditions. If I'm going to Florida, the conditions are very different than, even if they pick here and it's 8 hours and I'm very good, but I go to Florida, the weather is totally different. If I go to Puerto Rico, uh, it can be also different, and then that's where I'm gonna have a problem, right? So this is what we need to do in regards to acclimating, right? We need to work and but take rest. We need to rest, especially more in this first week. We have to increase our work gradually, right? The amount of work that we do gradually. You don't have to do all this since the first week. You have to increase gradually. You need to use light clothing, baggy clothing, and clear colors, cotton, because this all makes the air go through at least. And of course, water, rest, and shade. That's why the standards that we're trying to look for are here. And now I'm gonna ask the doctor to talk to us about this. But first, I want you to get here in the chat. What is it that we need to do when a colleague, work colleague, is suffering disease, whether it's insulation, whether it is syncope, whether it's heat stroke? Arlette says take him to a place that has shade. Correct. Howard says it's also recommended to use the color, light color working, and also tell the supervisor, give a little bit of water, make it a little bit more light. Let's see what the doctor says. The first thing is going to depend in what symptoms do you have. Next one. Depending on the symptoms, if you're exhausted, if you can walk and move, and go to the shade, and then give you liquids to drink water and something shade, and then also rest. You're gonna put water and then on the back of the neck.
Es como les mencioné ahorita que hay evaporación del agua, se va a sudar, la ropa está mojada, pues tenemos que ver convección, le va a echar agua para que cuando el agua le caiga encima, pues eso va a ayudar, va a liberar el calor en el agua.
So it's gonna release the heat with the water, and then the body's gonna be refreshed. But spray water and shade so that the body starts to get regular, normalized. You cannot go back to work again until you feel good. And another one, if you're having more problems, if this is it's already exhaustion, we do the same thing. We need to be keeping an eye on this, because if you get deoriented and if you get heat stroke, you're not going to be able to respond well enough. You're going to be deoriented, and then the water, it's going to be and if he doesn't respond, and if you see that he's on the floor and he's not responding, you can give him water and take him to the shade, take his clothes off, spray water, put ice. And then if someone brings it, then but if he's not conscious, if they're not conscious, then you cannot give him liquids because he can choke. So we're gonna, but because aside of the heat stroke, you're gonna have problems on the lungs for aspiration. So what Alma said, shade, hats, drink a lot of liquids, and if this person falls or the patient says, I'm okay, there's nothing else, I don't have anything else, and if there's problems, and don't wait until he's deoriented to do something. You can just take him to the shade and tell him, let's rest, but don't give him a Sprite, Coke, 7-Up. It's water what they need to drink. And you don't pull out your coffee, no coffee, and you need to actually try to hydrate him through the skin, through the mouth, and water. And if there's something, if you see that he's significantly in bad shape, then you have to go take him to the hospital. They do IV liquids and they balance the temperature to help. But what we need is shade, water, cool clothing, and spray him with water. This is what it's more important than this. But what's more important is you are just checking on if there's something wrong. If the supervisor, they need to be monitoring this. You can call 911, the condition and everything. And you're gonna continue to do the first aid, spraying water, refreshing this person. You're not gonna wait until the ambulance gets there to start to do this, right? And put water in and give him cold water, or at least regular water, not hot water, because that's going to be worse. And then you notify the supervisor and the person in charge so that they see what's happening. They have to help you, and you have to avoid this from happening again, which is more important. And then for next time, we're gonna have to see this next time. So extreme heat pesticide use, and this is gonna make it worse. It's gonna threaten the safety, and all these elements are gonna be worse. They're gonna put in more pesticides. This affects the physical health of the workers and the communities that are near. It affects the community because everything is gonna be out of balance. It's gonna affect us, and it's gonna even affect the food that we're picking. There's gonna be more pesticides. This is a work that we need to do as a team. Some of them sell them, some of them pick the vegetables, some of them spray it. So this is a matter of all of us. We need to help everyone. So if they're in the fields, we need to avoid this. We need to help the prevention. And Dr. Rodriguez, there's a question here in the chat. Is it recommended to drink Gatorade and electrolyte? You can drink the electrolyte and the Gatorade, but at the time that you're having complication, it's water. If electrolytes is just when there's like cramps, right? Because then at that time sodium and potassium are out of balance, so that's what electrolytes are used for. And you can use that in the marathons, right? When they run, and sometimes they give you this, the electrolytes like get Gatorade, but it cannot be sweet. It cannot have a lot of sugar, but then it's gonna make it worse. Use the ones that are low in sugar that have electrolytes. This is very important. Thank you, doctor. Thank you. And something that I want to add for what the doctor says is that it is very important to know the place where you're working, the area where you are. In case that there's an emergency, an area specifically where you are, you're going to be able to reach there. And also let the supervisor know why, because there has to be a plan and where that you need to talk about, right? This is what is recommended. You have to have a plan for the employer. See about this, drink water, use shades or higher risk.
Que ya donde hay un
And
nivel de riesgo
high
muy
risk,
alto y donde ya es extremo. En
very
este
high
caso, en
risk
el extremo,
and
ya
extreme.
tienen
At
que
this time,
detener el
in the
trabajo, sobre
extreme one,
todo para los
you have
trabajadores
to stop
agrícolas
the
y no
work
permitirles
more than
trabajar
anything for the
porque lo más seguro es que ellos
workers
se van a
on the
enfermar.
fields. You don't need
¿Lo que
to
sigue?
allow them to work
Y bueno,
because there's a lot of
voy a hacer
danger
un
here.
resumen muy
So
breve
then I'm
sobre
gonna make
insolación y
a
síncope. Yo estoy
very
viendo que aquí los
brief
compañeros
summary
están
in
batallando
regards
con el
to
término en inglés.
insulation.
Les vamos a decir los
I see
términos en
here that
inglés, pero
the people
no
are
importa
having a
cómo le
hard time in
llamen, lo
regards to
importante
the
es
terms
que
in
ustedes
English. It
vean
doesn't
cómo
matter
va
how you call it,
increciendo, ¿no? Que va
but
desde unos
you see
síntomas
how this
hasta
is
el
increasing
golpe de calor,
the
donde todos los
in regards
órganos
to
terminan.
insulation
Entonces, sí,
to heat
tanto
stroke.
insolación como el síncope se
Insulation
pueden
or
revertir, pero
syncope
ya el golpe de
can be
calor ya es
reversed, but
prácticamente
heat
mortal.
stroke,
Muchas de las
it's
personas que sufren
basically
golpe de calor no se
cause of
recuperan, ¿no?
death. Many
Entonces, pero
people
se
that
puede
suffer heat
prevenir.
stroke, they
Y
don't get
hay
better,
que
but it's
alertar a
preventable.
los
And
trabajadores
you
y
have
que
to
entre ellos
alert
se haga
the
un
workers,
programa, una
and so
red.
that they
¿Qué es
can
lo que vamos a
have
hacer si
a
alguno de
program
nosotros se
amongst
enferma?
them.
Si alguien
What is it
está
that we're gonna
diciendo
do if
incoherencias,
something
¿no? No es
happens
porque
to
toma
some
una
of
droga, quizás es
us?
porque está ahorita afectado por el
Maybe
golpe de
it's
calor y
because
está
they're
delirando,
affected
¿no?
for heat
Y
stroke,
tener
they're delirious
programas de
already, and
aclimatación, donde
having
poco a poco,
acclimation programs
incluso
to
entre los compañeros,
acclimate
ayudar. Si este es
themselves,
nuevo,
even
hay que
among the
dejar
workers.
que él trabaje
If
poco
this is a
menos,
new
aunque
worker,
quiera
we need
mostrar
to
que puede
let them,
trabajar tan fuerte, pero
work a
tiene
little
que
bit less
aclimatarse.
and
¿El que sigue, por
acclimating,
favor?
even if he wants to show that he can work more.
También tenemos, ya
Okay,
hablé de este
awesome.
sistema de amigos
We
y
need to
educarnos
talk
sobre los
about this
signos y los
friend
síntomas,
system and
informarse de las temperaturas,
tell us,
agua, descanso y sombra,
exhort us to
y
drink
una
water,
alimentación
tell
y
us,
una
tell
ropa
each other to drink
adecuada.
water,
¿Sí?
go to the
El que sigue,
shade,
por favor.
keep cool, and use the
La
correct
ley,
clothing.
según OSHA,
The
nos da
law,
también
according
ciertos
to
derechos y
OSHA, it's giving us
responsabilidades al
certain
trabajador. Y
seven
la que sigue,
rights
si
and
eres tan amable.
responsibilities
No me voy a
to each
detener
workers.
mucho en esto,
I'm not gonna
pero
stop here a lot.
sí, OSHA
OSHA
defiende a
defends
todo trabajador,
all
de
the
cualquier
workers,
raza, de cualquier
every
país de
race,
origen, de
every
cualquier
country,
lenguaje,
country
de
of
cualquier
origin,
género,
every language,
y
every
gane lo
gender,
que gane,
every
¿no? Con
pay rate,
estatus legal
whatever
o
they
sin
they
estatus
make,
legal para
with
trabajar.
or
¿No?
without legal
Todos
status
somos
to work.
humanos,
We're
entonces
all
se
humans, right?
protege a
So
los
we have
seres
to protect
humanos.
each other. This law
Adelante.
protects every human.
¿Y cuáles son las
What are
responsabilidades
the
de los trabajadores?
responsibilities of
Pues
the
es
workers?
seguir las reglas de
Well, it's
seguridad y
follow
salud
the
del empleador,
security and health
es
rules of the
usar el equipo
employer,
que se
use
requiere, aunque
the
no nos
required
guste a veces,
equipment,
es reportar
even if
condiciones
we don't like it
peligrosas al
sometimes,
supervisor
report the
y
condition, the dangerous conditions to
darnos
the
cuenta de que
supervisor,
si las cosas no
and
están bien, también podemos poner
realize that if things are not
una
okay,
queja
we
anónima
have
a
to make a
OSHA.
complaint
Y continuamos.
to OSHA and continue.
Estos reportes pueden ser
These
anónimos y
reports
estos son
can be
algunos de los
anonymous.
derechos de los
These are
trabajadores.
some
Son
of the
básicamente
rights of
que
workers.
todos tenemos el derecho a
Basically,
tener un lugar de trabajo
everyone
seguro,
has the right to
información,
have a safe place of
entrenamiento
work,
y protección. Nosotros
information,
tenemos que saber qué
prevention.
es lo que está sucediendo
We
porque es
have to
nuestro
know
cuerpo
what's
y nuestro
happening in
trabajo.
our
¿Qué
body.
sigue, por favor?
What's next?
Y bueno, yo
And
quisiera
well,
preguntarles a ustedes
I would
qué
like to ask
factores
you,
hacen
what
a
are
un
the
trabajador
factors that
inmigrante,
make
porque es con los que nosotros
a
trabajamos
worker, an
más
immigrant worker,
vulnerables en el
more
trabajo. El
vulnerable
doctor
at
mencionó
work?
muchos de
The
ellos.
doctor mentioned,
Si me pueden poner uno o
if
dos
you
por ahí.
can put one or
El
another
miedo,
one
tiene
here.
toda la
Miedo.
razón, Rebeca.
Fear, yes, you're
Miedo
right,
a
Rebecca.
ser deportado,
Fear
que
of being
lo
deported, yes.
castiguen.
El
Tiene toda la
lenguaje.
razón. Tiene toda la
Language
razón,
barrier.
toda la razón. El que sigue, por favor, la edad.
Next one,
¿sí?
please. The
Hay muchos
age.
factores, pero
There's
desde
many,
el
many
acceso a los
factors,
servicios de salud, si
but
tienen
access
aseguranza
to health,
médica o no,
access
el
to health
lenguaje, si
services,
le dieron el
if you have
entrenamiento
medical
del lenguaje,
insurance,
el tipo de
if you
trabajo,
have
si
the
hay
type of work,
intimidación,
if
si
there's
tiene
information,
documentos para
if
trabajar, ¿no?
if they have
Y aparte la cultura
documents
y las
to
tradiciones, porque
work,
a veces
the
pensamos que
culture,
si
the
allá en nuestro
traditions.
pueblo lo
Sometimes
podíamos
we
hacer
think
sin
that if
usar ningún
back
equipo de
there in
protección,
our
aquí también lo
town
podemos
we
hacer, ¿no?
were able to do
Entonces,
it without any
esto nos hace más
protection,
vulnerables
we
y hay
must
que
be able
tener
to
en
do it
cuenta
here.
esto. ¿Le que sigue,
This
por
makes
favor?
us more vulnerable and we have to be
Entonces,
mindful of this.
una última cosa.
So one last
Queremos
thing,
terminar esto
we have to
diciéndoles,
finish,
si
we
me la
want to
pones
finish
toda
this,
completa,
telling
que
you, and if you can
nosotros
put all of
podemos
them,
decirles a los
we
trabajadores
can
miles
tell
de
the
cosas, pero
workers
los trabajadores son los que
1,000 things,
deciden
but
qué
the
hacer.
workers are the ones
Y
that are
para
going to
que una
decide what to do.
persona decida
And
qué
for
es
a
lo que tiene
person
que hacer,
to decide
tiene que
what
tener
is it that they need to
entrenamiento,
do,
tiene que
they
saber,
need to have
tiene que tener
training, they need
acceso
to
al
know,
equipo
they
de
need to have
protección, tiene que
access to
conocer
personal
sus
equipment
derechos y
protection, they
tiene
have
que
to know
saber
their rights,
dónde
they have
están
to
los
know
recursos de la
what the
comunidad.
resources
Si
are
el
in their
trabajador
community.
tiene eso,
If a
entonces
worker
él puede
has that,
decidir
then
libremente
we're
qué es lo
always
que
going to
quiere o
freely
no hacer,
receive
¿sí?
what
Y
is it
no
that
es de que
decide,
usted
what
le
is it that
diga,
they're going to do.
usa esto y haz
You don't
esto.
have to
No,
tell them,
si él no toma la
use this or
decisión,
use that. If
nadie,
he doesn't make the
nadie lo va a
decision,
hacer que tome la
nobody
decisión
can make him
adecuada, ¿no? Él
take
tiene que
the
tomar o ella
correct
la
decision.
decisión.
He
Entonces,
or she
el
has to
trabajo de
make the
nosotros
decision.
es ese,
So our
darles
job is
estos
that, right?
elementos,
To
no
give him
obligarlos,
these
darles
elements,
estos elementos.
help them,
¿Qué
give him
sigue,
these
por favor?
elements. Next one, please.
Y queremos terminar
And
diciéndoles
we
que
have
van a
to finish
recibir
by
ustedes toda esta serie de
telling
recursos que tenemos
you're going to
disponibles
receive
en
all
nuestra
this type of
página de
resources
internet
that are on
para
our
que ustedes
website
puedan proporcionárselo a
so
los
that you
trabajadores.
can
Recibirán
give
también
this to the workers
esta
and so that they can also
grabación
receive
y
all this.
esta presentación que
And this,
nosotros
that they can
estamos
receive this
haciendo. Y no
presentation that
sé,
we're doing.
René,
And
con
that they
esto
can,
terminamos el
know
doctor y yo, a ver si podemos tener
this, what we
una o
made.
dos preguntas por ahí.
If maybe we can
Sí,
have a couple questions
si
from the
alguien
doctor.
en el seminario tiene
Yes,
alguna
if
pregunta
someone in the
para
webinar
Alma
has
o para el doctor Rodríguez,
question for Alma or
si por
Dr.
favor los
Rodriguez,
podrían
if
poner
you
aquí en
can
el chat.
put it here in the
Y
chat.
solo quería
And
cerrar esta
I just
sesión
wanted to close this
agradeciendo a todos los
session,
participantes, a nuestros
thanking
queridos
all the participants,
panelistas
all the
y
panelists,
recalcarles a
and
ustedes que
also
están aquí en
to
esta reunión,
highlight
que
all
son
of you
un
that are
elemento, el
in this
eslabón
meeting. You
principal
are a
para
very
no
big element,
solamente
the first step,
proveer la
not only
educación
to
a los
provide
trabajadores
education to the
agricultores o si
agricultural
ustedes mismos
workers,
trabajan en
but
el campo,
also if
pero
you work on the
recuerden que
fields yourself.
ustedes
But
tienen la
remember,
decisión de
you
tomar
have to make the decision
la prevención
of
o decidir
taking
que no, ¿verdad? Nadie los puede
prevention
obligar,
or decide
pero
not to
muy
take it.
importante,
Nobody can force you,
siempre
but it's very
mantenerse
important.
educado.
Always
Recuerden,
maintain,
recibir
always
información y
keep yourself trained
capacitación
and
en un
educated.
lenguaje que
Receive
ustedes
training
entiendan es su
and
derecho.
education in a language that you understand, it's your right.
Algo que quería mencionar que el
Something
golpe
that I
de calor
wanted to
usualmente
mention is
causa la
that
muerte,
heat stroke
pero hay
usually
pacientes
causes
que no
death,
mueren
but
y
there's
quedan con
patients
fallo
that
renal,
don't
les da un derrame
die,
cerebral,
but
les
they
da
get
un
a
ataque al
stroke,
corazón,
they get a
o sea, y
heart
quedan
attack,
con
they have
incapacidad.
renal failure.
Si
There's
no se mueren, quedan con incapacidad.
there's a
Gracias,
problem,
doctor. Y
long-standing
justo había una
problem.
pregunta aquí en el chat, rapidito,
That
Alma, porque ya sé que
Sí,
tenemos
claro
que
que
with them.
concluir, Alguien
or a
había preguntado
disability.
si alguien
There
se
was a question
enferma
here in the
con
chat.
el
If
golpe de,
someone
le da golpe de calor,
gets heat stroke,
después iba a quedar con estragos, sí.
they later have,
Si no se muere.
you know,
Doctor, puede,
ramifications
bueno,
of it. Yes.
sí, y el
Yes,
doctor les
of
va a
course.
poder ahondar un poquito más en
And the
esto, pero
doctor
sí,
is going to
una
be
de las
able to
problemas que
tell you in
tenemos
regards to this a little
es
bit more.
esta
One of the
enfermedad
problems that we
crónica del
have
riñón
is this
de causa
chronic kidney
desconocida y
disease
se cree
that is
que muchas de
unknown,
las
and it
personas
is
que trabajan
believed
en el
that
campo, que
many of
trabajan
the
en
people that
lugares
work
donde
on the
llegan
field
no solamente, no a
not
tener golpe de
only
calor, sino llegan a
have
tener nada
heat
más
stroke,
ciertos síntomas y luego
but also
regresan.
just
Lo
have
van dañando
certain
poco a poco a
symptoms,
su
and
sistema.
it's
Sí.
Entonces,
you start to damage
aparentemente
your
no hay
system little by little.
un
Apparently,
efecto
there's not
de
an
estar
effect
siempre
of
expuesto a eso,
always
pero a
being
la larga
100% to
sí
this,
lo hay.
but in the
Doctor,
long
¿puede
run,
usted ahondar en
there's
eso?
an effect.
Eso es bien importante
Yes, this
porque
is very important
principalmente el
because
riñón
mainly
que
the
va
kidney,
afectándose
right?
con la
Mainly it
hidratación porque le
affects the
llega
kidney
menos
with
líquido
hydration
y se
because
va
you start to have
afectando
less
y
liquids,
empieza de
and
categoría 1 a 2 a
you
3
start
y si es
first phase, second
diabético
phase,
está más
third
riesgo,
phase,
si es
and if
hipertenso
you're
peor
diabetic
todavía.
or
O sea que
hypertensive,
todas
it's
estas
even
cosas van
worse.
de la mano
So
y hay que
everything,
evitar y hay
all
que
this goes
cuidarse,
hand in hand.
proteger
So
ese
you have to
riñón
avoid it. You have to take care of yourself. You have to
De acuerdo.
avoid all this.
porque tener fallo renal
Because
es
having renal
diálisis y eso es más
failure,
complicado todavía.
dialysis is really more
De acuerdo.
complicated,
Y
Y
eso
a
es lo
lot
esto
que
more than that.
permite cuidar entre los
And
adultos mayores.
especially
No
taking
sé si
care
ustedes se dan cuenta que
of the
entre
elderly
la edad es
people.
más
I don't know
avanzada
if you
son menos
if you
tolerantes
realize
a
that
un calor extremo
when
o a un
you
frío
start to
extremo,
go, when
porque
you
la
start to have
termorregulación que
more
el doctor
age,
hablaba
or
no es la
when
misma.
the
Entonces hay que
elderly,
tener mucho cuidado
as
con
the
eso.
time progresses,
Sí,
the
sí mismo.
thermoregulation doesn't happen as
Sí que
much, and you
cuidarlo
start to be more
y enseñar a
vulnerable.
nuestros
So
agricultores a cuidar
we
si es
need
porque
to
estén en exposición.
show our
Y cuando
agricultural
vayamos a
workers
la playa,
that they are in this position, and
bloqueador
when we
solar,
go to
beber
the beach,
líquido, no
so
cervezas nada más y
sunblock, a
refresco,
lot of liquids, and just a
líquido,
couple of
agua,
beers,
electrolitos
a lot of
y
liquids, a
protegernos
lot
y
of
estar
water,
en la
a lot
sombra
of
también.
electrolytes,
Estando en
and
la
seek
sombra,
shade
en
as
la
well.
playa, sin
When you
hacer
seek
sol, se va a
shade,
quemar como quiera.
and
De
when you
acuerdo. Y
Tiene
no
are on the
reflejo.
shade on the
no
beach,
hablamos,
even if
doctor,
there's
de
no
los
sun, you're
problemas de
also
la
going to get
piel
tan.
relacionados con
We didn't
cáncer,
talk
Los cáncer
about
de
the
la piel.
rayos
cancer
ultravioletas.
related
No lo
problems
mencionamos
and
aquí
skin
porque
problems.
nos
We didn't
estamos
mention this
enfocando
here
más al
because we're
trabajo, ¿no?
focusing more
Pero
on this
sí.
type of work. But
Por ahí yo veía también que
yes,
quieren
also I
hablar
was
de
working there that
otras
you want to talk
profesiones,
about
¿no? Que también sean afectadas por el calor. Pues
professions,
como
right, that are
hablamos al
also
principio,
affected by
las personas que trabajan en
the heat.
empacadoras, las
We
personas
didn't
que
talk about
trabajan
this at the beginning.
arreglando
People
coches,
that work in
incluso las
packaging,
personas que están
fixing
trabajando en el
cars, and
campo,
stuff like
perdón,
that. People that
afuera,
are
que
working on the
venden
fields and that are
cosas afuera
outside and
también
they
están muy
sell things
expuestas,
outside and that are
restaurantes,
also very
infinidad.
exposed to
Todo el
this.
mundo, pienso yo, estamos en un momento dado
Everyone, I
expuestos.
think,
Inclusive
it's
en la
at the
casa,
time of
si
response.
se le
Even in the
daña el aire
house,
acondicionado y hace mucho calor,
if you
tiene
have
que haber
AC
ventilación,
and there's a lot of work, it needs to have
hidratación,
ventilation,
porque
and you
puede
need
de
to
un
be
agotamiento
hydrated
y de ahí
because
pasar una
there
insolación.
can be, you can
Y si
be
estás sola en
Roxana,
la casa con
you
niños,
can
con
be
más razón hay que dar
exhausted,
mucha
and
hidratación. Y
if
comer
if
frutas,
you're alone
que
in the
también la
house,
fruta
this can happen
ofrece
as well,
líquidos
and you
también
have
al cuerpo.
to,
No dulce,
drink
chocolate,
liquids,
galletas, frutas.
not candy,
tiene toda la
chocolate,
razón. Y
and all
Roxana nos
this,
está
cookies.
diciendo
You're completely
que en
right, and
Austin hubo un caso
she
de
was telling
fallecimiento
us,
de un
Roxana was
trabajador
telling us,
repartidor de
in
mensajería que
Austin,
están todo el
there
día en el
was
volante. Ese es
a
otro
death
de
also
los
of
peligros y
people
usted
that,
tiene que bajar y
delivery
subir y
people.
entrar. Entonces,
These are
aunque lleven el
some
aire
others are the
acondicionado, a veces
dangers.
no
Even if
no
they
pueden.
have
Entonces,
the
sí,
AC, this is not
es
enough.
muy
So
importante. Y los niños,
it is very
Reina
important.
habla de los
And the
niños cuando
kids
salen
also,
a jugar.
kids with
Totalmente de
disability, they
acuerdo.
go out to work. Exactly,
Hay
completely
una
right.
pregunta del bloqueador de
There's
75. Hay
also
bloqueador
for
hasta de 100
the
ya, pero
sunblock
la literatura
75,
dice que
even
después de
it's 100,
50
but
es lo mismo.
the literature
Lo
says
que
that
pasa
after
es que el
50 is
bloqueador
the same.
hay que
It's just that the
ponérselo
sunblock,
antes
you
de
have to
estar
use it
expuesto,
before
no cuando está
exposing
expuesto.
yourself, not when you're
Antes, por
already
lo menos media
exposed,
hora antes, 15
at
minutos,
least
media hora antes,
15 to
y después
30
cada
minutes
hora, cada 2 horas hay que
before, and then
volvérselo a colocar
afterwards,
otra vez.
every hour or 2
O sea, no es
hours.
que se lo pone por la mañana y
You
cuando regresa a las
you
5
don't
de la
use
tarde
it in the,
se
just in the
baña y
morning, and then when you
ya
come
no queda
back,
nada ahora, ¿verdad? Si está en la
because
playa
it
menos, que
evaporates,
está
there's nothing
mojándose.
left at that time.
Pero se
So,
dice que después de
but it
50,
said that
ya
after
los
50,
100 que yo he visto, que
after
no hace nada,
100,
que es lo mismo.
it's the same.
De acuerdo.
Muchísimas gracias a
Thank
nuestros
you.
queridos
Thank you
participantes y
all of our
panelistas.
participants and
Les hemos
panelists.
dejado aquí en pantalla las
We've
preguntas
let
posteriores
here
para que ustedes, por favor,
questions
vayan
in
a
the screen
responderlas.
for the
También les puse el enlace en la casilla
responses
del
for the
chat,
questions
al
that we
igual que
have.
Jessica lo
Also,
acaba
I
de
put
poner.
the link on the
Muchas,
chat,
muchas
just as
gracias por su
Jessica did.
participación.
Thank
Puerto Rico,
you really
Texas,
for your
Carolina del Sur,
participation.
Carolina
Puerto
del
Rico,
Norte.
Texas,
Teníamos a alguien
South
de
and North
India y hasta
Carolina.
de
We had
Canadá.
someone from
Muchísimas
India
gracias
and
a
Canada.
todos nuestros
Thank you
participantes.
everyone. Thank you
Les
for
haremos
the
estar
participants. We're
llegando
gonna
la
send
copia de
you
las diapositivas
we're gonna
y
send you the
algunos recursos
copies
de esta
of the slides and
presentación.
some resources for
Y
this
si tienen algunas
presentation.
preguntas,
And
no
if you have
duden
any
en
questions,
contactarme
don't
por
hesitate in
correo
contacting
electrónico.
me
Les
through email.
estaré haciendo
I'm
llegar
gonna send you
sus respuestas si tienen
responses for
alguna
you.
inquietud.
And if you have any
René,
questions,
muchas gracias por
René,
todo
thank
tu
you.
trabajo y
Thank you
para
for
todo el
everything,
equipo que
for
está
all your
detrás de
work
acá.
and for your
Muy
team
amables.
that is
Sí, muchísimas
behind all
gracias a
this.
todos.
Thank you.
Gracias,
Muchas
Thank you,
doctor.
gracias,
Gracias,
everyone.
René.
Thank
Alma,
you. Thank you,
participantes.
doctor. Thank you, Alma.
Se
Thank you, all the
cuidan y suerte.
participants. Thank
Gracias,
you.
Bien.
Take
buenas
care. Good luck.
tardes.
Thank
Ok,
you.
adiós.
Good afternoon.